The CANDOR study was a randomized open-label multi-center phase 3 trial that compared the combination of Daratumumab, Carfilzomib, dexamethasone to Carfilzomib, dexamethasone in myeloma patients with 1 to 3 prior lines of treatment, and the primary endpoint was PFS. And the original data was reported after a median follow-up of about 17 months at ASH in 2019. There were updates at last year's ASH in 2020 with additional 11 months of data. And then subsequently, at the COMy meeting, I updated those data, especially looking at the PFS for the study overall, as well as for pre-specified subgroups. The study was a 2-to-1 randomization schema. Patients had to have a PR or better in at least one prior line of treatment. And after at the original follow-up of about 17 months, PFS was reached for KD at 15.2 months, and that for Daratumumab KD had not been reached. But with an additional 11 months of follow-up, the median PFS was reached in the Dara-Kd arm at about 28.6 months compared to that 15.2 in the KD arm. And more impressively, I think, looking at the subgroup analyses for patients who had len exposure or refractoriness, you were seeing the similar kind of PFS benefit of about 26 to 28 months in the subcategories that included patients who had len-refractoriness after one prior line of treatment, as well as 2 and beyond. And the hazard ratio was even better for those subgroups compared to the overall population. There weren't any new safety signals that were observed. The depth of response was better in terms of overall MRD negativity on the study as well. And then additional analyses were done in the trial that looked at MRD negative rates at the 12-month landmark period, as well as patients who had sustained MRD at different time points as well. And at the time of the report, no patients with MRD negative CR had progressed. So those were the key features or salient findings that were reported at COMy.